अच्छा केस आसुनी तो टेस्ट करिए कि ना ट्रांसफर आसी एटा ऑन गुड आफ्टरनून सर हेलो गुड आफ्टरनून
Good afternoon, ma'am.
hello
Good afternoon, good afternoon.
hello it is
Good
audible
afternoon, ma'am. Good afternoon, ma'am.
hello it is audible
Yes, ma'am. Yes, ma'am.
okay thank you now I would like to discuss regarding the infection control in the ICU. ICU is one of the place where all total mostly infectious patients and life-threatening condition. They are most probably in the severe illness cases are admitted in the ICU. So infection control is very important. Now my topic is infection control in ICU. All total, what is infection, what is inflammation, and how we are totally it is removed from the hospital setup and reduce the infection. So now topic I would like to discuss regarding the infection control in ICU. Topic now it is sharing. It is visible.
Yes, ma'am.
Okay.
Ma'am, can you tell which block this one?
Hello. Any problem?
Ma'am, which block this one?
How? Hello. It is audible.
Yes, ma'am.
Yes,
Now
ma'am. Yes,
the introduction part is care is increasingly being delivered in a wide range of the setting, and the control of the infection is an important and integral part of the health and social care. Infection control policies and procedure already exist for the hospital setting. However, they are often inappropriate for the carriers in community setting. The emergence of the life-threatening infections and re-emerging infectious diseases have highlighted the need for the efficient infection control programs in all healthcare settings. Then some of the terminology in this chapter, the terminologies of nosocomial infection, agent, OSA, fumigation, disinfectants, all total. You also know regarding these terminology, but review is essential. So, nosocomial infection. Anyone from the group? What is nosocomial infection?
It is a
ma'am.
hospital-acquired
Hospital acquired infection called hospital infection.
Ma'am, non-infectious and
Not sharing. PPT. Hello.
No, ma'am. No, ma'am.
PPT is sharing or not? Hello, student.
Ma'am,
PPT is sharing.
it is the infection acquired from the hospital.
Yes. Nosocomial infection means hospital-acquired infection are caused by viral, bacterial, fungal pathogens. Agent sometimes that procedure or is capable of producing an effect. Effect it either chemically, physically or biologically. ଏଇଠି ଯୋଉ ଗୋଟେ ଦେଖାଯାଏ ଛୋଟ ଫଟୋ ହେଲା ସେଇଟା କଣ ଦେଖାଯିବନି ଏଥିରେ ଆମର ଫେସଟା ଦେଖାଯାଉଥିବ ଆମେ ତାଙ୍କୁ ପ୍ରେଜେଣ୍ଟ କରିବା ସେମିତି ଦେଖାଯିବନି
এটা মিট রে করছেন না
ନହେଲେ ଥାଉ ଯଦି ପଳେଇବ ବୋଲେ ଆହୁରି ଟେନସନ୍ OSHA means occupational safety. Occupational safety and health administration. Mhm. Sharing of
Right side easy. Screen visible also.
Visible. Then OSHA, Occupational Safety and Health Administration. Then next is fumigation. Fumigation to apply smoke, vapor or a gas to disinfecting. Then disinfectants, a chemical liquid that destroy the bacteria. All are follow. Hello students, it is audible.
Yes, ma'am.
Okay. Then this decontamination. All you know that the hospital setting also decontamination, how it is decontaminated. Every procedure after the decontamination is highly essential in the clinical side also, and as well as operation theater decontamination of the instrument. You know that the process of the cleansing an object or the substance to remove contamination such as a microorganism. Then isolation. Isolation is the voluntary or the compulsory separation of those known or suspected to be infected with any contagious disease to prevent other infection. Then next comes to host. Who is host? Host is an animal or a plant or a any type of parasites or the organism livings. Then infection. Infection is defined as the entry of an infectious agent into the host and its multiplication within the host that create the microorganism multiply and create the infection. Then next, standard safety measures. Standard safety measure means standards is a predominant level of the excellency that serves as a guide for practice. Standard safety measures means how we are standard maintain and safety measures, not any type of infection to the patient attendant and also healthcare providers. Okay, standard measure we are applying in the different setup. The standard measure a quality type and a high level standard we are using in the infection control measures. Okay. Then next, save the lives in the healthcare, prevent infections. Then what are the problem? First problem is the patient. This is all about the how to different types of problem. What are the problem and how to the problems are arises. It is visible.
Ma'am, presentation we are not seeing.
Anyone from the group, please.
Ma'am, there is nothing to see.
It is not seen.
PPT is not displayed, ma'am. PPT is not displayed.
ମ୍ୟାମ୍ କହୁଛି କି ପିପିଟି ତମେ ସେୟାର କରନି ମ୍ୟାମ୍, ପ୍ଲିଜ ପିପିଟି ଟା ସେୟାର କର, ବୁଝିପାରିବେ।
PPT share ହଉନି। ହଁ share ହଉଥିଲା ମ୍ୟାଡାମ। ନ କହୁଛନ୍ତି ପିଲା। PPT share ହଉନି। Okay, I will try. Hello. ହଁ କ୍ଲାସ୍ ଚାଲିଛି, ଟିକେ ପରେ ଆପଣ 6ଟା ପରେ ଫୋନ କରନ୍ତୁ, ଯାହା ଅଛି କ୍ଲାସ୍ ଚାଲିଛି ହେଲା। ହଉ ଥ୍ୟାଙ୍କ ୟୁ। ଦେଖିଦେବି। PPT share ହଉନି, ଆମେ ହଁ ପରା।
ମ୍ୟାମ୍ ଏବେ ସେୟାର ହେଇଛି ମ୍ୟାମ୍।
देखिए ओके ओके
तो साउंड टा कम दीजिए
ବେଶୀ ହେଇଯାଉଛି ମ୍ୟାଡ଼ାମ କହିଲେ ଯାଉ ଯିବ ନା ହଁ ଯାଉ ଯିବ ଯିବନି ସାଉଣ୍ଡ ଆଉ ଟିକେ ଆଗକୁ ଆସିଲା ଦି ତିନିଟା ଚେନ୍ ଆଉ ଟିକେ ସତ ନାହିଁ ଉପରକୁ ଦି ତିନିଟା ସ୍ଲାଇଡ୍ ହେଇଛି ଜଷ୍ଟ ହଁ ଇଣ୍ଟ୍ରୋଡକ୍ସନ ସରିଲା ଏଇ ସ୍ଲାଇଡ୍ଟା ହେଇଛି 3 ନମ୍ବର 5 ନମ୍ବର ଏଇଟା ଟିକେ ଇଏ ମାନେ ଦେଖା ଯାଉଥିଲା ହଁ ହଁ ଫୁଲ୍ ସ୍କ୍ରିନ୍ slides are visible
हाँ मैम विजिबल
ma'am.
okay thank you okay prevent infections save lives in the healthcare then what is the problem what are the problems we are seeing in the clinical setup first 1 in 10 patients get an infection while receiving care okay while we are providing care while the patients are received the care that time in 10 persons 1 person getting infection due to ignorance of the healthcare provider or the lacuna of different types of hospital strategy okay then it is one of the problem then second problem up to 32% of the surgical patients get a post operative infection up to 51% antibiotic resistance okay 32% surgical patients are post operatively infected due to lack of care and also different cleaning is not sufficient for the that patients then up to 51% antibiotic resistance then next problem is up to 90% of the healthcare workers do not clean their hands in some facilities okay some of them were not sufficient scrubbing process or some of where water is insufficient and some of the problem like overburden of the staffing also patients are very much very crowded but the staff is not that much okay then next problem is infections caused up to 56% of deaths among the hospital born babies okay infections caused up to 56% of the deaths among the hospital born babies up to 20% of the African women get a wonderful infection after a cesarean section then next problem 50 to 70% of the infections given in some developing countries are unsafe. Then infections can be lead to disability, antibiotic resistance, and increased hospital time and death. These are all problems of the hospital side. Then next is how it is solved. Solutions are have active infection prevention and a control problem programs and target antibiotic resistance okay first is how to solve the problem solve mainly depend upon the have a active infection control prevention and a control program we are initiated by the government and also target antibiotic resistance then second one is a use clean practices if we are sufficient amount of the hand washing procedure and sufficient amount of the pp uses then the asepsis procedure for follow the intervention different therapeutic intervention then we are clean the practices use the clean practices and asepsis for the intervention then third one is a practice hand hygiene okay practice hand hygiene to prevent the infections and reduce the spread of antibiotic resistance Then fourth one is have enough staff, a clean and a hygienic environment, and do not overcrowded the healthcare facilities. Then next, monitor the infection and make action plans to reduce their frequency. Then never reuse the needles and syringes, and only dispense antibiotics when truly needed, or they reduce the risk of the resistance. These are all to prevent the infection, save the lives in the healthcare setting. Healthcare without avoidable infections. Then it is an infection prevention and a control contribution to achieve the sustainable development goals, and it could save the millions of the lives, according to World Health Organization. Okay, then Then, what is infection? Infection is a condition that results when the microorganism cause injury to a host. Infection differs from colonization, a condition in which microorganisms are present but the host does not manifest any signs and symptoms of infection. Infection control is discipline concerned with the preventing nosocomial infection. Infection control and hospital epidemiology are akin to public health practice. Practice within the confines of a particular healthcare delivery system rather than the directed a society as a whole. All you know that the what is infection, how infection is manifest in the different microorganism enter into the body, and they are colonized, and the condition which is microorganism present in the body automatically favorable condition have present, then it will be manifested, and somewhere it is clearly sign symptoms are seen. Then after the how infection control is a discipline concerned to preventing the nosocomial infection. Okay, hearing holes. Then this is all about the microorganism. Some of the microorganism picture we are picking. Then how infection occurs. Okay, how infection occurs? Infection occurs through a process known as a chain of infection, which involves a series of interconnected events and factors. The chain of infection consists of 6 key links. Because and for an infection to occur, each of these links must be present. Okay, first is pathogens. Then after pathogens, they enter the reservoir and the portal of exit. And first is pathogens. They enter the new host. They enter portal of entry. Different entry point. They are if the skin is breaking in the human body, then easily they are enter. If in the nose, in the different way, they are a portal of entry. Then means of transmission and portal of exit and reservoir. These are all the linked 6 linked chain of the infection enter into the human host or a living being host. Then next is the infectious process cycle. This is all about the infectious process cycle. That is, first is pathogens like bacteria, virus, fungi, parasites. They are the pathogens. Susceptible host, mainly susceptible host who are those who are elderly people. They are automatically immune compromised, and some of the people are their defense system not properly function, and there is system wise disease also occur. Then next is infants. Infants are immature in the immune system. Then immunocompromised disease condition, if the patient having HIV or any other immune compromised disease, then they are also susceptible to host. Then anyone Okay, these are the susceptible host. Then portal of entry through mouth, through nose, through eyes, caught in the breaking of the skin. These are the portal of entry. Microorganism enter into the body, and then after they manifest and body create different signs and symptoms. Then mode of transmission. Mode of transmission, it directly contact to the patients or a human being, then indirect contact or a different factors borne, factor bites. Okay, one by one I will discuss. Reservoir. Reservoirs means people, animals, soil, and food, water, which is the mainly favorable condition to grow the microorganism. Okay, if the reservoir must be a people or maybe animals or maybe a soil or maybe a food or a water. Then portal of exit. Portal of exit through coughing, sneezing, bodily secretions and feces. These are all portal of entry to microorganism in the human body or any other living things. They are in the outside of the body. Portal of exit from the body to their exit. Okay, this is all about the infectious process of the cycle. All are understood, student? Hello,
Yes, ma'am.
student. Yes. Then next we are move chains of infection. Chains of infection, that is infection agent or the pathogens. We are already discussed agent or a pathogens. Microorganism include bacteria, virus, fungi, protozoa. Microorganisms on the skin may be resistant or transient flora. Then a reservoir. Reservoir is a place where the pathogens can survive. Okay, favorable condition they are found. Then after they grow. Okay, but may or may not multiply for hepatitis. Example: hepatitis A virus survive in the shellfish. Shellfish but does not multiply. Likewise, some of the examples in the reservoir. Then portal of exit. Portal of exit, after microorganism find a site to grow and multiply, they must find a portal of exit. If they are another host or another host and a cause disease, it can exit through the variety of sites such as the skin. If the skin is break down, the skin or a mucous membranes, respiratory tract in the throat, coughing, sneezing, urinary tract through the urination, and gastrointestinal tract through the vomiting or any way, then reproductive tract and a blood. These are the portal of exit. And mode of transmission. Mode of transmission, there are many mode of transmission of the microorganism from the reservoir to the host. Certain infectious disease tend to be transmitted more commonly by specific mode. However, the same microorganism may be transmitted by more than one route. Okay, that is the mode of transmission. Then next is a portal of entry. Portal of entry, organism can either the body through the same routes they use for the exit for the for that is example, when a contaminated needle pierces a client's skin, organisms enter the body. Any obstruction to the flow of the urine from the urinary catheter allows organism to travel of the urethra. This is all about the portal of entry. Then susceptible host. Who is susceptible host? When a person acquires an infection, depends on the susceptibility to an infectious agent. Okay, then susceptible depends on the individual degree of the resistance to the pathogens. Individual, if the individual having a immunity power sufficient, they are fight against the organism. So if susceptible depends on the individual degree of the resistance to the pathogens. Okay. Then agents causing infections. Those agents who are causing infection, mainly bacteria, virus, fungi, mycoplasma, and rickettsia, chlamydia. These are the all microorganisms. They enter into the body causing infection. How we are prevent from them? Okay. Then bacteria. Bacteria are the single-celled organism. They have different shapes, round shaped cocci, rod shaped bacilli, and spiral shaped spirochete. Okay. Then viruses. Different viruses. Viruses are smallest pathogens. They are incapable of reproducing outside the living cell. Then fungi. Third one is a fungi. Fungi are prevalent throughout the world, but few are capable of causing disease in the human body. They grow in two forms, yeast and molds. Then mycoplasma. That is mycoplasma, although similar to bacteria, mycoplasma are smaller. They are more resistant to antibiotics such as a penicillin and a cephalosporin. Then next one is a rickettsia and a chlamydia. It is similar to bacteria and cell on ticks. Okay, cells of the arthropods. Arthropods ticks is one of the example. Then sources of infection. Sources of infection: endogenous, exogenous. Endogenous means the infection infectious agent is derived from the normal flora of the individual. That is internally endogenous. Okay. Then exogenous infectious agent is derived from the external source. It may be human, or it may be animals, or it may be any insects. These are the exogenous source of infection: endogenous and exogenous. Then human carrier human spread the infection to the susceptible host. Animals, infection found primarily in animals but accidentally transmitted to humans are called zoonosis. Okay, zoonosis. That is example: bacterial functions like anthrax and a viral infections like rabies. Then insects. Many insects are capable of transmitting infectious disease are called vectors. Biological vector, mechanical vector. These are all the insects bites or different types of insects. Through insects are mainly many insects are capable transmitting infection or disease are called the vectors. Okay, it may be biological or it may be mechanical. Then next, types of carriers. Okay, types of carrier based on the duration. Temporary carrier based on the how infection is acquired, then based on the whether the carrier manifests the disease. These are the all total types of barriers. Barriers based on temporary duration. On duration, temporary carrier, infectious agent carried for less than 6 months, that is temporary carriers. Chronic carriers, infectious agents carried more than 6 months. Then based on the how infection is carried, acquired. Contact carrier, infection is acquired from the patients. Contact carrier, that means infection is acquired from the patients. That is contact, one person contact to other. That is the carriers. First, patient is a carrier. Contact carrier, infection is acquired from the patient. Then paradoxical carriers, infection agent acquired from the another carrier, one carrier to another carrier. That is paradoxical carriers. Then based on whether the carrier manifested the disease, first is healthy carriers do not suffer from the disease previously. Then convalescent carriers, they are last, but now are carriers. Okay, they are the mainly convalescent carrier. They continuously last, but now the carriers. They are lasting the disease, but they are now carriers. Then modes of infection. Modes of infection: contact, direct contact, indirect contact, ingestion, inhalation, inoculation, lactogenic, and a congenital. Then one by one, classification of the infection: primary infection and a secondary infection. Primary infection: initial infection with an organism to a host constitute primarily primary infection. Okay, primary infection means initially infection with an organism to a host constitute a primary infection. Then secondary infection, when a host whose resistance is lowered by the pre-existing infections. A new organism may set off a new infection. That is known as a secondary infection. Then next is local and systemic infection. Local infection means you are all know that any localization of the infection, local site infection that is limited to a defined area of a single organ with symptoms that resemble inflammation, redness, tenderness, swelling. These are the clinical symptoms. Anywhere, if the abscess is arise in the body, then the infection that is a limited area, limited place. Okay. Then to a defined area of a single organ with symptoms that resembles inflammation. That is known as inflammation. The inflammation, how we know that? If the area is redness, or if we are touching or a palpate, then it must be a tenderness, and the area must be a swelling. That is known as a local infection. Infection that spread to the one system to another, or the spread throughout the body, that is known as a septicemia. Okay. Acute and a chronic infection. Acute infection appears suddenly or lasts for a short time. That is example, URI, urinary tract infection, or renal infection. Suddenly it appears, then after it will be disappear with appropriate medication. Okay. Then may occur slowly over a long period and may last months to year. That is known as a acute and a chronic. Then next is nosocomial infection. Nosocomial infection, it is nowadays it is known as a what? Nosocomial infection.
Hospital acquired.
Hospital acquired infection.
Yes, acquired infection and healthcare associated infection also it is known nowadays. Okay, nosocomial infection. It is known as a hospital infection. These encompass all type of infection acquired by patient while being cared for in a acute care institution, and those acquired by healthcare personnel and visitors. Then next, lactogenic infection. Infection result due to therapeutic and a diagnostic procedure. If we are doing any type of procedure in the clinical side or a hospital, then infectious results resulting due to therapeutic and a diagnostic procedure. If we are, for example, LP procedure we will do. If it is unsterile, then it automatically the needle is not sterile properly, or sterilization is a problem, then the infection enter into the body. It is create another problem. So therapeutic purpose, any type of therapeutic procedure or the diagnostic procedure, at a time an infection appears, that is known as a lactogenic infection. Then breaking the chain of infection. Okay, how we will break the chain? If the infection chain is breaking, then automatically the infection is reduced, and the patient staying also very less time in the hospital. Then as healthcare professional, we cannot provide healthcare services without some exposure to potentially infectious materials, but we can prevent transmission many cases. Okay, transmission many cases. Then infection control measures and practices. Infection control measures and practices are essential strategy implemented in a various settings, particularly in a healthcare, to prevent and manage the spread of infectious disease. These measures are designed to break the chains of infection and protect the both healthcare workers and the patients. Then next is, here are the key points. Key points in infection control measures and practices. What are the key points? First is hand hygiene, PPE, personal protective equipment, standard hand isolation precautions, environmental cleaning, immunization, antibiotic stewardship, and a surveillance and a monitoring, training, education, and a monitoring the different healthcare practitioners through by education. Okay. First is standard safety measures. What is the standard safety measures? With increased awareness of contamination from blood-borne pathogens. Okay, that is example hepatitis A, hepatitis B, hepatitis C, hepatitis B, blood-borne disease, and HIV also one of the infected. So blood-borne disease, so many blood-borne disease. That is example hepatitis B and hepatitis HIV. Came realization that definite precautions should be taken to prevent the infection. It is one of the safety measures, two standard safety measures. Then next is the Center for Disease Control and Prevention is a part of the US Department of Health and Human Services, provide facilities and services for investigation, prevention, and the control of disease. Then third point is the CDC. CDC means Communicable Disease Control Guidelines, revised in 1996 for isolation precaution in the hospital, and how now been, that is care facilities are provided to the patients. These are all standard safety measures to prevent the major the infections. Then the guidelines have been designed to reduce the link of the bloodborne pathogens and the pathogens from the moist body substances. Then these guidelines applied in the blood, any body fluid, secretions, and excretion, except sweat, regardless of the whether or not they contain the visible blood. In case of HIV cases, the only transmission is blood content. If the blood have sweat or any type of regardless the secretion contains the blood content, then it is automatically infectious. Then non-intact skin. Okay, the skin is intact, so it is not transferable to any infection. Then mucous membrane, it is also intact. Then five movements. It is some spelling mistake. Five moments for the hand hygiene. Okay, five moments for the hand hygiene. One is before the patient contact. Then all you know that before the patient contact. Then second one is before aseptic task, and third one is after body fluid exposure risk, and fourth one is after patient contact, and any procedure after contact, after we are definitely wash our hands for the, then after we document the all total procedure. Then next is 5 day after contact with the patient surroundings. These are all 5 moments for hand hygiene. Okay, hand hygiene how we will apply before contact of the patient, after any type of before aseptic task we will therapeutic procedure done. Then next is after body fluid exposure risk, and fourth one is after patient contact, and fifth one is after contact with the patient and the surrounding. These are the 5 moments for the hand hygiene. Okay. Then before patient contact, clean your hands before touching the patient when a appropriate him or her. Then before an aseptic task, any type of clean your hands immediately before and any aseptic task. Then after body fluids exposure risk, clean your hands immediately after an exposure risk to body fluids after gloves or a removal. Then after patient contact, clean your hands after touching a patient and his or her immediate surrounding when leaving. Then after contact with patient surroundings, clean your hands after touching any object for furniture in the patient's immediately surrounding, also without touching the patient. All total the 5 moments, the moments how we are apply in the healthcare setup. Patient before touching, after any type of before any type of aseptic measures, aseptic task we will done any procedure on in a aseptic technique, sterile method. Then after body fluid exposure, any type of body fluid exposure, then we definitely wash our hands properly. Then after the patient contact and after the contact with the patient's surrounding. These are all 5 moments for the hand hygiene. Then standard precautions, hand washing. Hand washing, hand hygiene can also be a problem in busy healthcare center and clinics where the patients are seen both in the increasing numbers and treated in a rapid succession. Then occupational safety and health administration, OSA. OSA standard requires that employer must provide rapidly accessible hand washing facilities. Three kinds of hand washing facilities: hand washing with a plain soap and a running water, then hand washing with a antiseptic soap and a running water, then alcohol hand rub. Then the steps, you all know that 7 steps of the hand washing with the soap and water. Okay. Then palm to palm. First one is a palm to palm. Then second step is between the fingers. Then back of the hands. Third one, and the base of the thumbs. Okay, base of the thumbs we rub. Then next is back of the fingers, like picture, and the fingers nails in the middle portion. We are rubbing the fingers nails, fingernails, then wrist, then rinse and with the dry. These all the 7 steps we follow in hand washing. Okay. Then next, personal protective equipments. First is gloves, goggles, N90 mask or a triple layer mask, gown, apron, and cap. Okay, these are all the PPE used in the clinical setup to prevent infection. One by one, first is gloves, then goggles. Okay, one is apron, fourth one is the shoe cover, fifth is mask, and total sixth is apron. Yeah. Personal protective equipment (PPE) must be one on site every day, every person, and every time. Okay. Then globing. Globing gloves provide a barrier against the potential infectious infectious microorganism that can be found in a blood, other body fluids, and a waste. Three kinds of gloves: surgical gloves, single use examination gloves, utility or the heavy duty household gloves. These are the gloves. Different types of gloves how we are using in the different setup. Okay, then goggles. Goggles or the face shields are used to protect the eyes from the flashes or the sprays of the body fluid, blood or a body fluids. Personal eyeglasses or the contact lenses are not considered adequate eye protection. Goggles should wrap around the sides of the face to protect the flashes from all equipment, all types of procedure. Okay, goggles mainly when we putting the done the CS procedure at that time, amniotic fluid will be flushes. Or any operation theater, if the artery cut down, then the blood will be classes. So at the time we compulsory uses the goggles in the setting care in the clinical site. Then masks. When a mask is correctly applied, it will be fit snugly and securely over the nose and the mouth. The device should be changed after 20 to 30 minutes, or if it becomes moist. Mask should not be reused or dangled. Okay. Then next is gowning. Gowning means apron. If you are wear a sterile gown, you must complete a series of procedures referred to as a scrubbing, gowning, and a gloving. Then shoe covers. Wear shoe covers to provide a barrier against the possible exposure to the organism or a contact with with contaminated environment. Okay. Then personal protective equipments covers the gowns. They open in the back to reduce the inadvertent contact with the client and objects. Then next they have close fitting wristbands to help avoid the non-contaminating the forearms. Then the fasten at the neck and the waist to keep the gown securely closely. Those covering all the wearers of the clothing. Okay, the wearing how to wear gloves, gown, and the gown must be protect our body and our clothes, not enter the any type of microorganism through the infectious person to healthcare providers. Okay. Then face protection device. You all know that in the clinical side and during the corona period also some face shield everywhere used in the clinical side, OPD, outdoor clinical, the operation theater, anywhere face shield protecting device we are using. Depending on the mode of the transmission of the pathogens, healthcare personnel wear a mask or a respirator, goggles, or a face shield to protect the mucous membranes of the eyes when conducting procedures that are likely to generate splashes of the blood, body fluid, and secretion, or the excretions. If disposable, discard appropriately. If they are reusable, decontaminated them according to the manufacturer instructions. They always apply these items before entering the client's room. Okay? These are all things we know, but it is a review of the session. Then gloves. Gloves change gloves between the contacts with different changes gloves between the contact with the different patients. Change gloves between the task procedures on the same patient to prevent the cross contamination between the different body sites. Gloves are not a total and a complete barrier to microorganisms. They are easily punctured and can leak the potent potential for the leakage increase with the stress of use. Okay, then wearing gloves does not replace the need for the hand antisepsis after removal. These are all regarding the gloves. Some of the picture we will see the max, goggles, gloves, cap. Okay, then max wear a mask to protect the mucous membrane of the mouth, nose when undertaking procedures that are likely to generate flashes of the blood, body fluid, secretions, and excretion. Wear surgical masks rather than cotton material or the gauze mask. Surgical masks have been designed to resist fluids to varying degrees depending on the design of the material in the mask. Do not reuse disposable masks. They should be disposed of the according to the healthcare facilities and protocols. Then next is ventilation. For the operating room, the critical parameters for air quality include frequent, frequent maintenance, validation of efficacy of filters in according with the manufacturer of the requirements. Then second one is a pressure gradient across the filter bed and the in the operation theater. Air changes per hour, minimum 15 air changes per hour. Then temperature should be maintained between 20 centigrade to 22 centigrade. Then and humidity between 30% to 60% to inhibit the bacterial multiplication. Then general area should be not air conditioned. General area should be open place and then not air conditioned. Then protective environment. Okay, protective environment. Healthcare workers and visitors should avoid contact with the patients if there are any infections. Where appropriate, staff visitors should wear personal protective equipment to protect the patient from the microorganism. Do not put flowers or a plants in the room. Ensure a tidy environment. Tidy environment. Environmental cleaning should be done twice daily and should consist of the damp dusting only. Do not create aerosols. Then use the strict aseptic techniques procedures for the treatment modality. Then safe drinking water is also highly essential in the hospital setting and prevent the infection. Store water in a hygienic environment. Do not allow the hands to enter the storage of container. Then dispense water from the storage container by an outlet fitting with the with a closure device or a tap. Then clean the storage containers and water coolers regularly. Then waste management. Biomedical waste management also very important in the hospital setting and ICU setting. So waste management steps in the management of the of the hospital waste, including generation, segregation, separation. Segregation means separation, and collection, transportation, treatment, and a final disposal. Okay, these are the steps of waste management. Then one by one, principles of the waste management: develop a plan which minimize the amount of the waste generated. And first hospital, any ICU, develop a plan which minimize the amount of the waste generated. Second one is a segregation, segregate clinical infectious waste from non-clinical waste in the dedicated containers. Okay. Then next point is transport waste. Transport the waste. How to transport? From the clinical, from the ICU, from the different sources. How to transport? Transport in a dedicatedly trolley. Okay, trolley. We are seeing in the hospital. Hello students. Where are you?
Yes, ma'am. Yes, ma'am.
Any problem?
No, ma'am.
तो कंटिन्यू करेंगे.
हाँ हाँ मैम.
ओके ओके ओके. Then देखो transport waste in the you are all healthcare provider, you also see that how the trolleys are transported. Okay, transport waste in a dedicated trolley, store waste in the specified areas with a restricted areas. Okay, specified area to restricted area. Then next point is collect and store the sharps. Different types of sharp instruments collected and stored in a sharps container. White one bucket having a sharp container. The sharp instruments all are collected from our hospital. Okay, collected and stored the sharps in a sharps container. Then a sharps containers should be made of plastic or a metal and have a lid that can be closed. This should be marked with the appropriate label, logo, that is biohazard symbol. Okay. Then next is segregate medical waste. Okay, with the bag or a container, plastic waste, that is IV sets, then tubings, blood and urine bags, syringes. These are all bag or a container. White. Then next is yellow bag container, infectious waste, soiled bandage, any dressing materials, or a pathological waste, any type of waste, pathological from the lab. Okay. Then tissues, different types of any organism or any dressing tissues cut down. Okay. Then placenta, all you know that infectious, these are the yellow bag contains the infectious waste. Then black bag container, mainly general waste, that is paper and a plastic packing. And unsoiled plastic, a plaster cast, if the patient having a plaster cast, already remove it and it will be discarded. Then kitchen waste, these are the black container. Then next is waste sharps stored in the separate puncture-proof container. Okay, these are all regarding the all segregation medical waste. Then next is this is the collecting some of the picture regarding the collection of the waste, how it is collected and how it is separated, segregated, and the plants are big plants are working for the waste management. Okay, storage treatment, incineration. Sunanda, 1 minute please. Okay, we will move to next slide. Disposing. Okay, it is a plant. Some of the plants waste management, biomedical waste management. The plants are disposing the biomedical waste. Then color coding. Okay, color coding and types of the container. Color coding. Yellow container category 1, category 2, and category 3, category 6. Okay, these are the yellow container. Then treatments, incineration and deep burial. Okay, these are the incineration and a deep burial. Then red container category 3, category 6, category 7. That is autoclaving, microwaving, chemicals. Then blue white, that is blue white uh, translucent, category 4, category 7. That is autoclaved, microwaving and chemical treatment and a destructive threading. Then black container category 5, category 9. These are all regarding the disposal in the secured land filling. Okay, these are all the different coding, color coding category wise that are listed, and materials will be discarded. Then sharps, autoclave thread handed land fillings or the microwaves thread, and land fillings or the treat by a plasma pyrolysis of puncture probe containers or storing the discarded sharps. Deep burial in a secure area. Burial should be 2 and 3 meters deep and at least 1.5 meters above the groundwater level. Then different waste requiring incineration, anatomical parts and anatomical animal carcasses and cytotoxic drugs, residual and outdated toxic laboratory chemicals. These are all waste requiring the incineration. Then waste may be incinerated, patient contaminated non-plastics and non-chlorinated plastics. These are the waste that
ମ୍ୟାମ୍ 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 କହୁଛି କି ଆପଣ ଯୋଉ ପଢୁଛନ୍ତି ନା ଯେଟା ଯେ ଚାପ୍ଟରଟା ସେଇଟା ସ୍ଲାଇଡଟା ଏବେ ବି ପଛରେ ଅଛି ମ୍ୟାମ୍, ସେଇଟା କଣ୍ଟିନ୍ୟೂ ହେଇନି, ନେକ୍ସଟ ହେଇନି ମ୍ୟାମ୍।
next that is not wrong. Next
କହୁଛି ପାଞ୍ଚରେ ଏବେ ବି ସ୍ଲାଇଡ୍ ଅଛି ମ୍ୟାମ୍, 5 ନମ୍ବରରେ ଏବେ ବି ସ୍ଲାଇଡ୍ ଅଛି। ତମେ ଯେ କଲର କୋଡ୍ ଯେ BMW ଟା ପଢୁଛନ୍ତି ସେଇଟା ଏବେ ବି ମାନେ ସ୍କ୍ରିନର ଭିଜିବଲ ହେଇନି ମ୍ୟାମ୍।
oh, oh, oh. So I will call. Okay. I will see.
ଓକେ ମ୍ୟାମ୍।
ସ୍ଲାଇଡ୍ ଟା ସେୟାର ହଉନି କହୁଛନ୍ତି, ଆମେ ଯୋଉ ସ୍ଲାଇଡ୍ ଦେଖଉଛୁ ଟିକେ ଦେଖିଦେଲ ସୁନିତା, ସ୍ଲାଇଡ୍ ଟା ଯାଉଛି ତଥାପି ଲେଟ୍ ଯାଉଛି। हेलो हेलो
हाँ मैम।
no this slide
ମ୍ୟାମ୍ ସେ 5 ନମ୍ବରରେ ସ୍ଲାଇଡ୍ ଅଛନ୍ତି ମ୍ୟାମ୍, 5 ନମ୍ବରରେ ସ୍ଲାଇଡ୍ ଅଛନ୍ତି।
ବହୁତ ସ୍ଲାଇଡ୍ ହେଇଗଲାଣି, 5 ନମ୍ବରରେ ଅଛି କହୁଛନ୍ତି। ନା ନା ତାକୁ ଡାକିଲ କାହିଁ ଯାଉନି ସ୍ଲାଇଡ୍ ଟା ଯାଉନି କହୁଛନ୍ତି ତ, 5 ନମ୍ବର ସ୍ଲାଇଡ୍ ଅଛି ବୋଲି କହୁଛନ୍ତି। କ୍ଲାସ୍ ଚାଲିছে, ଟିକେ ପରେ କଥା ହବ। ଯାଉନି, 5 ନମ୍ବର ସ୍ଲାଇଡ୍ ଅଛି କହୁଛନ୍ତି। ବହୁତ ସରିଲାଣି ସ୍ଲାଇଡ୍ ଗୁଡା ତ, ମୋର ତ କେତେ
ମ୍ୟାମ୍ ଏବେ Class 2 ରେ ଆସିଛି ମ୍ୟାମ୍।
ଆସିଲାନି କେତେ ନମ୍ବର ସ୍ଲାଇଡ୍
Yes, ହଁ ଏବେ ଆସିଛି ମ୍ୟାମ୍ 32 34
ବୋଲେ ଏମିତି ଥିଲେ ଦେଖାଯିବ ତାଙ୍କ ସ୍ଲାଇଡ୍ ହେଲା। ହଁ ଥାଉ ଥାଉ ସେଇଟାକୁ ଆମେ ଆଉ ଟିକେ ତଳକୁ ତଳକୁ ଯିବା। ହଁ ସେପଟେ ଏପଟେ କହିଲେ ଏପଟେ
এটা তো তଳକୁ ମାନେ ନେକ୍ସଟ 35 ସ୍ଲାଇଡ୍ ଏଇଟା 36 ସ୍ଲାଇଡ୍ ଏଇଟା ଏଠୁ ମାଗି ଯାଉଛି
ମାସ୍କ ଭେଣ୍ଟିଲେସନ ପ୍ରୋଟେକ୍ଟିଭ ଏସବୁ ହେଇସାରିଲାଣି। ସେଫ୍ ଡ୍ରିଙ୍କିଂ ୱାଟର ୱେଷ୍ଟ ମ୍ୟାନେଜମେଣ୍ଟ ଏସବୁ ସରିଗଲାଣି ତାଙ୍କୁ କିନ୍ତୁ କିଛି ଦେଖାଯାଉନି।
ଦେଖାଯାଉନି
5 ନମ୍ବର ସ୍ଲାଇଡ୍ ଥିଲା
5 ନମ୍ବର ଥିଲା ଏବେ ଦେଖିପାରିଲେ ସେତେବେଳେ ବି ଆମେ ସେୟାରିଂ କରିଥିଲେ ନା
ହଁ ପୁରା
ସେଇ ସେୟାରିଂଟା ହଉନଥିଲା ସେ ହଉନଥିଲା ନା କଣ ଏବେ ଦେଖାଉଛି ନା ପଚାରନ୍ତି
now it is visible hello
Yes,
Yes,
ma'am.
ma'am.
Yes, ma'am. Yes,
Now it
ma'am.
is visible.
it is a 48 number slide
48 हाँ 48 नंबर ଅଛି ମ୍ୟାମ୍ ମୋର।
हाँ हाँ ओके ओके ओके
केते नंबर अच्छे
now 49 number slide total
49
number 95 slide
केते
okay
केते कहउजंती मैम
95
क्लियर नहीं आउछ मैम
okay
साउंड क्लियर नहीं अच्छे मैम केते नंबर कहला जे
95 number slides total then it is a 49 okay
Dear learner, I request you, ma'am should continue. Don't worry for the slide.
okay okay
You can understand what ma'am is going to taught you.
okay
The slide is not important.
हाँ
Ma'am continue.
okay ma'am okay okay waste that may be incinerated, patient contaminated, and a non-plastic and a non-chlorinated plastic. Oh, okay. Then waste that should not be incinerated. That is chlorinated plastic, volatile, toxic waste such as mercury and a plastic, non-plastic. Contaminated with food, body fluids, secretions, and excretion and infectious laboratory waste. These are all the waste that should not be incinerated. Then linen, okay, linen. The linen, all you know that the linen wearing in the different therapeutic procedure and surgical operation and patient also some of the hospital wearing linen in the admission time. The hospital protocols they follow. The basic principles of the linen management are as follows. Then plastic used linen in appropriate bags at the point of generation and that is contains linen soiled with a body substance or the other fluids within the suitable impermeable bags and close the bags securely for the transportation to avoid any spills or drips of the blood and body fluids and secretion or excretions. We maintain the linen. Then next is do not rinse or the sort the linen in a patient care area. Sort in the appropriate area. Then handle all the linen with a minimum agitations to avoid the aerosolization of the pathogenic microorganism. Then separate the clean from the soiled linen and transport stored separately. Okay. Then wash used linen sheets, cotton blankets in the hot water 70 degree centigrade to 80 degree centigrade and detergent rinse and dry preferably in a dryer or in the sun. Heavy duty washers or dryers are recommended for the hospital laundry. Autoclave linen before being supplied to the operating rooms and theaters. Wash woolen blankets in the warm water and dry in the sun in the dryers at the cool temperature or the dry clean. Then next comes to bedding. Bedding mattresses and pillows with the plastic covers should be wiped over with a neutral detergent. Mattresses without plastic covers should be steam cleaned if they have been contaminated with the body fluid. If this is not possible, contamination should be removed by the manual washing and ensuring adequate personal protective environmental protection. Then wash pillows. Pillows either or using the standard laundry procedure described above and dry clean if contaminated with the body fluids. Then after cleaning, disinfection and sterilization. Okay, and there are four main methods used for the cleaning of the instruments and equipments. Manual cleaning, when we required manual cleaning, and enzymatic cleaners, ultrasonic cleaners, and automated washers disinfection. Then first is thermal. There are two types of achieving disinfection: thermal disinfection, pasteurization, that known as pasteurization if an instrument is able to withstand withstand the process of the heat and the moisture and is not required to be sterile. Then thermal disinfection is appropriate by using heat and water by temperature and destroy the pathogens vegetative agents. This is a very efficient method for disinfection. Then next it comes to chemical disinfection. Chemical disinfection, in disinfection, the performance of the chemical disinfection is dependent on the number of the factors, including temperature, contact time, concentration, pH, presence of organism or the inorganic matters, and the number of the resistance of the initial bio burden on the surface. Next comes to sterilization. Sterilization is a destruction of the all microorganism and can be achieved by the either physical or the chemical methods. Then sterilization is necessary for medical devices penetrating sterile body sites. First is exposure, that is that the instrument can be withstand the process steam under the pressure. Second one is ensure that the instrument has been adequately cleaned. These are the two process of the sterilization. Then ensure that the instrument does not require any special treatment. Ensure that records of the sterilization process and for the uh, traceability of the instrument that keep steam under the pressure, moist heat sterilization and dry heat sterilization, ethylene oxide EO, and automated chemicals low temperature system and irradiation. These are all the regarding the sterilization. Then safe injection practice. Safe injection practice is one of the important tasks and intended to prevent the transmission of the infectious disease between the individual and to prevent the injuries such as the needle sticks. Then second one, in developing countries, 16,000 million injections used each year. Injections used each year. 90% of the therapeutic purposes, while 5 to 10% are given for the preventing the services, including the immunization and family planning. Then next is according to the study conducted in the western region, around 385,000 needles sticks and others have related to injuries are sustained by the hospital healthcare workers annually. Nearly 15% of the needle stick injuries occur during or after the disposal. The next, safe injection practices include aseptic techniques using a single syringe and a fluid infusion sets only one. Then using a single dose vials when possible. If multi-dose vials used, be used, then use and store them according to the manufacturer recommendation. Then safe handling SAPs. Safe handling of SAPs, there is a very real potential to cause needle sticks or the cuts resulting in the infection. With the research agents or the generator aerosols, while using SAPs, aerosols can be produced by forcing materials through the needles, causing a sprays. Then removing a needle from a serum vial, pasteurization by injecting more air and then the volume withdraw. And a cutting or a sharing the needle, do not cut this or a shear or a bend any needles. Then after sac disposal. Uh, okay, 2 minutes break. हाँ हाँ थोड़ा थोड़ा वेट हाँ हेलो ତମେ ସାଇନ୍ କରିଦେଇଛ ଯୋଉ ଜାଗା ଦରକାର ଆମ ଘରୁ ଗଲେ ସେଟା କରିବ କିଛି ଅସୁବିଧା ନାହିଁ ଯାହା କରିବାର ଅଛି କରନ୍ତୁ ହେଲା ଠିକ ଠିକ ମନେ କରିବ ଫଟୋ ଚାରିଟା ପଠଉଛି ତମ 6ଟା ବେଳେ ସରିବ ପାଗରୁ ହଜାର ହଁ ସରି କଣ କରିବ ଏ କାମ ମ୍ୟାଡାମ ବତେଇଲେ କିଏ କରିବ ଆଉ ମୋର ଯିବେ କାଗଜପତ୍ର ରଖିଦଉଛି ଏଥିରେ ଖାଲି କମ୍ୟୁନିଟି ବେସ୍ ଆଡ୍ କରି ମତେ ଟିକେ ଫୋନ କରନ୍ତୁ କରିବାକୁ Okay, student. Now we will start. Sharp disposal. Okay, sharp. How to dispose of sharp instruments? Do not require do not recap and bend or break the. All are mute, please. All are mute. Do not recap, bend, or the break the needles. Okay, and dispose of all salves immediately after the use, or and only in the salves container. Then salves containers may be pur- purchased from the scientific supply companies, and the salves containers must be rigid, puncture proof, and have a lead seal securely, and observe the containers opening. If the salves are protruding, do not put your hands near it. Then prevent yourself. Never overfill the salves container. Only 3/4 will be covered, filling. Okay. Then next, replace salves container when they are 3/4 full, and if the salves are contaminated with the hazardous chemicals or a radioactivity, dispose of them in the separate salves container with the radioactive or the chemical waste tag as appropriate. Note on the waste tag if the salves is also biohazardous. Then managing injurious and exposure. Was the needles stick site? Okay, was the needles stick site or the cut with the soap and water? Flash the flashes flashes on to the nose, mouth, or skin with water. Irrigate the flashes to the eyes with the water or a saline. Then next, infection control and infection prevention and a control. OSHA is a federal agency in the United States that protect workers from the injury and illness in the place of the employment, and support activities that minimize or the eliminate the exposure to the infectious materials in the workplace. Then appropriate PPE varies depending on the situation of an nurse. You need to use sound judgment when and how to use the protective equipments. Then infection precautions. Infection precautions. If a patient admitted with or develop an infection that is considered a risk to others, infection precautions may be needed. The CDC, Communicable Disease Control, has established guidelines with the two levels of the precautions. Standard precautions are designed for the care of all patients in the hospital and the healthcare facilities. Transmission based on the precautions are designed for the specific disease. Then the standard precautions system applies to blood, all body fluids, secretions, and secretions, non-intact skin, and a mucous membrane. Standard precautions are designed to reduce the risk of the transmission of the microorganism in the hospital. The CDC standard precautions inappropriate all the OSHA bloodborne pathogen standard requirement. Then infection control program. The infection control program most probably apply everywhere in our hospital setting. The recommended procedure is identify the interest ward personnel and identify the funding, if any, study existing practice and assess whether the change is required, formulate simple, easy to follow practices, policies, and modify the policies according to without comparing the infection control, use common sense in the decision making, and maintain the standard of care. These are all infection control programs. And the components of the infection control program: basic measures for the infection control, standard and additional precautions. Then education and training of the healthcare workers and a protection of the healthcare workers, immunization, identification of standard and minimizing the risk, surveillance and incident monitoring. Then next is the outbreaking investigation. Outbreaking investigation, then infection control in a specific situation and research, effective work practices and a procedure such as environmental management practices, including the management of the hospital, clinical waste and support services, food, linen, and use of the therapeutic device. In addition to implementing the basic measures for the infection control, healthcare facilities should prioritize their infection control needs and design their program accordingly. The next, infection control committee functions mainly formulate and monitor the patient care policies, advise on the purchase of the clinical and non-clinical equipment, as this may be involved in the directly or indirectly or in cross infection. Then liaison between the with the nursing and medical staff on new policies and a procedure, educate all hospital staff in the infection control program, realize the saving resulting from the infection control program, and realize the saving resulting from the infection control program, and redeploy their funds to improve the patient care. The next, infection control committee goals provide a central place for reporting infection, investigate cases of infection, determine the cause of infection, maintain total statistics related to the numbers and the types of the infections that occur in the facility, and evaluate the effectiveness of the protocols after they have been tried. Offer continuing education for the healthcare personnel to prevent infection. Serve as a consultant in the cases of the questions or the concern of the healthcare personnel. Then next come to continue, that is review of the records of the clients to identify the organism that may have become resistant to various drugs, and assist in the employees health and wellness program, and conduct research related to infection control practices, and conduct product evaluation for the infection control items. Then members of the infection control committee, mainly hospital administrator, then infection control doctor, infection control nurse, and these members are the from the infection control team. Then representative of the medical staff, representative of the nursing staff, pharmacist, engineer, and a sterile supply manager. Then next, nurse as a manager, a role in the control of the hospital acquired infection, formulating policies, education, and prevention. Then care of the healthcare workers, exposure to human human deficiency virus, exposure to hepatitis B, C virus, sharp injury, tuberculosis, severe acute respiratory syndrome, then meningococcal meningitis, other infection, varicella, influenza, pertussis, diphtheria, etc. Then nursing care, all you know that every time where the nurses provide care and support the all infectious patients, and also we serve as a multi agent, all total we did our all total nursing care and counseling, and consult different types of patients, we monitoring the infection control role also. So assessment is highly essential. Nursing care, risk of the first is nursing care, risk for the injury related to sensory and interrogative dysfunction on the manifested by the altered mobility, and a faculty judgment. These are all risk for injured related to any type of risk that may be sensory or integrative or a dysfunction or any type of manifestation of the altered mobility. These are related to infection. Expect the nursing care or intervention, how we positioning the patient, place the client in the in call light within the reach of the hand and giving instruction, explain all safety motivation. Okay, these are all you find that, and perform frequent visual checkers of the client, use of the safety belt, all transport to the patient one place to another place, one ward to another ward, and evaluate the client's ability to use of the toilet, often the rise of the toilet seat or the grab bars if indicated, assist the client in performing the hygiene. Okay, these are all regarding the nursing interventions. Then expected outcome according to their rationale also. Anything we will do, then what is the rationale behind it? That is mostly important. Rationale, if the patient is risk for injury related to, that is if the patient positioning the patient, that rationale is low position, minimize the distance to floor if client fall. Then a call light allows the client to call for help. Then client and a family will be feel safer if they are aware of the safety promotion strategy. These are the all total rationales behind it. Then after expected outcome, most probably the client will be experience a decrease in the frequency and severity of the injury events. The nurse and the nursing safety will be identify the safety issues in the work environment and decrease the injury events. Okay, then next risk for the injury, that is systematically organized. What risk of the injury means, what are the goals and a nursing outcome and a nursing intervention. You read all the medical surgical books, any things we will implement the nursing process. Then first is assess and diagnosis, nursing diagnosis, then goals, then according to goal we are implementing the care, then after we observe the nursing outcomes. Okay, then implementation, nursing action. Nursing action area of the safety, health promotion, health care, healthcare environment. Mainly nurses must help the client develop the personal safety habits. Then the CDC and OSA provide the guidelines for the promotion and the safety of the healthcare settings. ANA provides the strategy for nurses and accomplish the guidelines. Then next, healthcare environment. The total healthcare environment will be added direct and a recommendation to create a safe environment. Then each accredited healthcare settings has an ongoing healthcare and a safety program. The client is at a risk for the injury in the healthcare environment because of the unfamiliarity of the procedures the client undergo, and the nurses are responsible for protecting the client from the environmental hazards, whatever they provided services. Then nurses are also responsible for anticipating and minimizing the adverse consequences of the procedure and the treatment. Okay, then some of the examples of the infection control forms in the hospital we are using. Some of the hospital, big hospital also, they are introduced some of the infection control procedures, and they are evaluated through that. Okay, observe tools for the assessment of the hospital. Tools means questionnaire for the assessment of the hospitals. criteria: hospital of keeping and a full compliance 2 months, weightage partial compliance 1 month, and non-compliance 1 month. If the patient having A1, then level of the illumination lighting in a various areas. A2, that means different hospital criteria, hospital how to assess the hospital assessment criteria. Okay, these are the examples of the different hospital. Big hospital, they are infection control area we observing. Oh yes, anyone from the group? Anything?
Yes, ma'am.
Anything you will ask? No? These
No,
are
ma'am. No,
the
ma'am.
different tools, ward management tools, and these are the only evaluation tools. Okay. Then summary. Till now we discuss about the introduction, definition, change of infection, classification, breaking of the chains of infection, standard safety measures, standard precautions in the medical asepsis, surgical asepsis, disposing contaminated equipment, infection prevention.
मैम
Yes.
मैम क्वेश्चन थी मैम कि असाइनमेंट कैसे केमती
कैसे
करो
लिखना
लिखने
है?
हाँ
कैसे
हाँ
लिखना है? असाइनमेंट का क्वेश्चन है तुम्हारे पास, वो उसको डाउनलोड करो। डाउनलोड करने के बाद एक एक का 0331 एंड 032 में टू असाइनमेंट, असाइनमेंट का क्वेश्चन लास्ट में है, तुम देखो क्वेश्चन। ओके,
अच्छा मैम
क्वेश्चन देखो। क्वेश्चन में A4 पेपर में दोनों साइड लिखना है, अच्छा से लिखना है, और हेडिंग है तो कुछ कलर पेंसिल में लिखना है, पेन में, उसको चारों तरफ मार्जिन
मतलब
डालना है।
ब्लैक
Can
एंड
you
व्हाइट या
explain
दूसरा भी
हाँ, तुम जो भी ग्रीन कलर यूज करो, कि कलर यूज करने से रेड यूज मत
मतलब
करो। हाँ,
हाँ मतलब ग्रीन चलेगा मैम
हाँ ग्रीन चलेगा। ग्रीन वो टोटली ग्रीन नहीं है, कंटेंट में
नहीं नहीं और अंडरलाइन देने के लिए
ब्लू है, और साइड हेडिंग तुम ग्रीन लिख सकते हो, वो बहुत अच्छा से दिखता है। ओके,
मैम
साइड
बोल रही थी मैम मतलब बोथ साइड एक पेज का बोथ साइड A4 साइज का बोथ साइड में लिखना है कि एक ही साइड में लिखना है फिर दूसरा
बोथ साइड लिखना है। पिछली बार तो स्टूडेंट ये है बोथ साइड लिखकर, कुछ प्रॉब्लम नहीं है। ओके, असाइनमेंट होगा, फिर सेल्फ एक्टिविटी, सुपरवाइजर एक्टिविटी। तुम लोग यहाँ आने के बाद कुछ बच्चे आएंगे प्रैक्टिकल के लिए, वो सभी बच्चे आने के बाद
Ma'am, can you explain in English?
Excuse me, ma'am.
यस यस, बोलो।
मैम फर्स्ट
Can you
दिन
explain
सर
in English, ma'am?
Ma'am, in induction programs are told that we have practical exam in the respective study centers only.
हाँ हाँ हाँ, प्रैक्टिकल एग्जाम हमारा सेंटर में होगा, पिछले बार भी हुआ था, लेकिन
No, actually, ma'am, I am from Kashmir, so I have study center in Srinagar.
वो कश्मीर से
Yes, ma'am.
बहुत ज्यादा दूर है। दिल्ली कश्मीर है तो बहुत बहुत डिस्टेंस है ना। हमारा कोलकाता से बच्चे, कलकत्ता कलकत्ता से बच्चे
मैं
लेवल
मैं
जो
Yes,
कलकत्ता से
ma'am.
हूँ मैम मैं वेस्ट बंगाल से हूँ मैम
वो लोग आए, 15-20 डेज क्लास और क्लिनिकल एक्सपोजर भी हुए, क्लिनिकल साइड वो सब सेल्फ एक्टिविटी, सुपरवाइजर एक्टिविटी किए। तुम्हारे सेटअप में सेल्फ एक्टिविटी होगा। ओके, दोनों एक्टिविटी होने के बाद ही तुम्हारा कोर्स कंप्लीशन है।
हाँ मैम हमको मुझे तो कश्मीर में ही होगा ना
हाँ, तुम्हारा हम लोग रीजनल से पूछेंगे,
ओके
रीजनल
मैम
जो भी एडवाइस देंगे वही होगा, कुछ प्रॉब्लम नहीं है। सभी को ये तो डिस्टेंस कोर्स है ना,
यस
इसलिए
मैम
कुछ प्रॉब्लम नहीं होगा, आई थिंक।
मैम और एक बात
थैंक यू
पूछना
मैम
था मैम
हाँ, पूछो पूछो।
मैम बोल रही थी कि जो रिटिन एग्जाम है वो हम कहाँ पे देंगे
तुम्हारा सेंटर जहाँ है, तुम लोग कोलकाता से है तो तुम्हारा थ्योरी पार्ट वहाँ ही एग्जाम होगा, लेकिन प्रैक्टिकल पार्ट का हम लोग यहाँ करते हैं। इफ स्टूडेंट हैविंग कश्मीर, दिल्ली, तो वो ओरिजिनल जो भी सेंटर में सेट करेंगे वही होगा।
Correct,
मतलब
ma'am.
तुम लोगों के लिए वो दूसरा जगह होगा
अब दो
मतलब
दिन के लिए प्रैक्टिकल के, तुम्हारा वहाँ प्रैक्टिकल कर कर यहाँ आओगे एग्जाम देने के लिए। एक बार तो उड़ीसा आना चाहिए ना, एनी डिस्टेंस कोर्स हम लोग पीएचडी करते हैं राजस्थान, सब लोग जाते हैं, तो हम लोग भी, हमारे लिए भी बहुत डिस्टेंस है राजस्थान। ये सब
नहीं नहीं, वो प्रॉब्लम नहीं है मैम, मतलब मैं पूछ रही थी जो कश्मीर या दिल्ली का है वो वहाँ प्रैक्टिकल करेंगे, लेकिन हम लोग जो कलकत्ता से है हम लोग को जाना पड़ेगा, मतलब बहरमपुर जाना पड़ेगा। और एक बात जो
नहीं, अभी मैंने नहीं बोला है, प्रैक्टिकल का एग्जाम यहाँ होगा सभी बच्चों को, ये दिल्ली हो का राजस्थान हो।
ओके मैम। और
प्रैक्टिकल का जो आवर्स है वो डिसाइड करेंगे, कितना आवर्स यहाँ आएंगे, देखेंगे थोड़ा आईसीयू सीसीयू, तुम्हारा कोर्स तो आईसीयू सीसीयू का रिलेटेड है।
हाँ मैम।
हाँ आईसीयू,
हाँ।
कितने लोग आईसीयू में एक्सपोजर है? सभी
मैं हूँ
बच्चे?
मैम, मैं हूँ मैम।
यस मैम, यस मैम, हम लोग हैं।
आईसीयू आईसीयू में ड्यूटी करते हैं?
यस मैम।
हाँ मैम करती हूँ।
हाँ हाँ, तो अच्छा है, ये कोर्स तुमको बहुत हेल्प करेगा, इसीलिए मैंने तुम लोग प्रिंसिपल मैम और रीजनल सेंटर से पूछना चाहिए।
मतलब रिटिन जो मैम आपने बोला कलकत्ता में, मैंने मतलब कलकत्ता में कहाँ पे देंगे?
सभी स्टूडेंट यहाँ आएंगे, लेकिन सेल्फ एक्टिविटी वहां से कलेक्ट करो, पेशेंट को डाटा, पेशेंट कौन सा पेशेंट है, रेस्पिरेटरी पेशेंट, और उसका कैसे हम लोग डाटा कलेक्शन करेंगे, उसका डिजीज क्या है, हम लोग जनरल नर्सिंग, मिडवाइफरी और बीएससी नर्सिंग में किए हैं ना नहीं? डाटा कलेक्शन किए है ना नहीं, असेसमेंट किए, डिफरेंट सिस्टम वाइज असेसमेंट किए, ऐसे ही होता है। हेल्थ टॉक दिए है तो हेल्थ टॉक, ड्रग का चार्ट लिखना है तो लिखना है, ऐसे ही मेंटेन करना है रिकॉर्ड।
मतलब मैं जो क्लियर नहीं हो पा रही हूँ मैम, हम लोगों को जो रिटिन एग्जाम देना है वो रिटिन एग्जाम हम लोग कहाँ पे देंगे?
तुम्हारा सेंटर में, तुम्हारा जो सेंटर है,
मेरा हम लोगों का तो भुवनेश्वर है।
नहीं नहीं, भुवनेश्वर
मतलब बहरमपुर है, बहरमपुर है।
नहीं नहीं, वो रिटन एग्जाम के लिए बरहमपुर नहीं है, वो प्रैक्टिकल के लिए बरहमपुर है, बरहमपुर सेंटर ओनली फॉर प्रैक्टिकल।
आप खुद चूज कर सकती हो अपना, ये रिटन एग्जाम के लिए सेंटर खुद चूज कर सकती हो वेस्ट बंगाल के लिए।
यस, खुद चूज कर सकते हो।
मतलब जब एग्जामिनेशन फॉर्म हम फिलअप करते हैं वहाँ पे प्रेफरेंस मिलती है कहाँ पे सेंटर रखोगी?
ओरिजिनल वो सेंटर ढूंढेंगे, दिल्ली में एक सेंटर और कश्मीर में, वो अलग अलग सेंटर वो लोग रखेंगे। जून में एक एग्जाम है, दिसंबर में एक एग्जाम है, वो सेंटर चूज करेंगे, लेकिन वो जो तुम्हारा इन्फॉर्मेशन के लिए वो सब 03, 04 कहाँ सेंटर जाएगा, वो सब पेपर इवैल्यूएशन के लिए वो भेजेंगे, समझा?
ମୁଁ ଆଉ ଗୋଟେ କଥା କହିଥିଲି ମ୍ୟାମ୍, ଯେ ଆସାଇନମେଣ୍ଟ ଗୁଡ଼ା ଲେଖିବି ସେଟା ସବମିଶନ କରିବା ପାଇଁ ଭୁବନେଶ୍ୱର ଯିବାକୁ ପଡ଼ିବ, ମୁଁ ଆଉ ମାନେ କୋଲକାତାରୁ ସେଇଠି ରିଜନାଲ ସେଣ୍ଟର ସବମିଟ କରିବାକୁ ପଡ଼ିବ?
सुनंदु, you submit through postal, our address लेकर हमको सभी सबमिट करना है। अभी 160 स्टूडेंट है, सभी का असाइनमेंट यहाँ आएगा, क्योंकि तुम्हारा लिस्ट हमारे पास है ना, 160 स्टूडेंट का लिस्ट हमारे पास है, असाइनमेंट और जो सेल्फ एक्टिविटी, ये सब हमारे पास आएंगे, तुम पोस्टल में भेजो, हमारे पास आ जाएंगे। कॉलेज ऑफ नर्सिंग बरहमपुर, गवर्नमेंट कॉलेज ऑफ नर्सिंग एमकेसीजी एमसीएस बरहमपुर, स्टडी सेंटर का नंबर है 213721।
और एक मैम हम जाके उधर सबमिट कर सकते हैं ना मैम?
आना नहीं चाहिए, आना क्यों? तुम्हारा पोस्टल नहीं है क्या? तो पोस्टल में भेजो, जब भी हम लोग बुलाएंगे प्रैक्टिकल के लिए, जब भी हम लोग बुलाएंगे प्रैक्टिकल के लिए, प्रैक्टिकल के आना है, प्रैक्टिकल के।
ओके मैम, ओके मैम।
ओके, टोटल ड्राफ्टिंग गाइडलाइंस और नोजोकोमियल इन्फेक्शन, तुम लोग वो 314 ब्लॉक 4 उसमें इन्फेक्शन कंट्रोल का टोटल है, बायोमेडिकल वेस्ट मैनेजमेंट।
मतलब हम लोगों को मैम तो स्टडी मटेरियल अभी तक नहीं मिला है, और क्या है, फोन में करने में दिक्कत हो रहा है।
नहीं, स्टडी मटेरियल डाउनलोड करो ना,
हम
डाउनलोड
लोग तो डाउनलोड किया है मैम, लेकिन फोन में पढ़ने में दिक्कत हो रही है ना, मतलब
फोन
इतना
में
सारा।
क्यों, उसको
इंटरव्यू
प्रिंट
यहीं से
आउट
लेके आओ।
निकालो ना, प्रिंट आउट निकालने से कुछ प्रॉब्लम नहीं होगा।
मतलब स्टडी मटेरियल तो आना था ये 3 महीने के बाद भी, लेकिन नहीं आया। मतलब ये सब अभी प्रिंट आउट करने जाओगे तो एक प्रिंट के लिए 10 रुपए लगता है मैम। मतलब इतना सारा डाउनलोड करने के लिए कितना सारा पैसा लगेगा।
हाँ वो तो जरूर, लेकिन तुम रीजनल को एक मेल भेजो, रीजनल सेंटर को भुवनेश्वर को, वो सभी बच्चे को उसका एड्रेस लेकर वो सभी बच्चे को भेज दो। ओके,
मतलब हम लोग मेल किए थे मैम, वो बोल रहे कि हाँ चले जाएंगे आज सुन आज
एक
सुन।
बार इन्फॉर्म कर देंगे सर, वो बच्चे सभी बोलते हैं हमारा स्टडी मटेरियल नहीं आया, तो हम लोग भी इन्फॉर्म कर देंगे। ओके, कुछ प्रॉब्लम नहीं है, स्टडी मटेरियल तो सभी बच्चों को मिलता है, क्योंकि वहाँ प्रीवियस टाइम 26 बच्चे आए थे, सभी के पास उसका बुक था, क्योंकि हम लोग भी वो सब डाउनलोड नहीं किए हैं। अभी अभी हम लोग देखते हैं ऑनलाइन में क्लासेस है, तो हम लोग वही बच्चे से बुक लेकर हम सब वो डिस्कशन करते थे। प्रीवियस टाइम कलकत्ता से बच्चे आए थे, सब बच्चे कलकत्ता से, तो कुछ प्रॉब्लम नहीं है, वो स्टडी मटेरियल सब मिल जाएगा।
मतलब स्टडी मटेरियल्स नहीं मिलने से पढ़ाई में भी दिक्कत हो रहा है, और असाइनमेंट लिखना भी तो बहुत।
हाँ, लिखना भी बहुत दिक्कत होगा, क्योंकि
और मतलब हम लोग बहुत साल, मतलब मैं 19 साल में पास आउट हुई हूँ। और अभी क्या है मैम, हम लोग प्रैक्टिकल जानते हैं, प्रैक्टिकल करते हैं, लेकिन थ्योरी बहुत दिन छोड़ दिया है। तो मतलब अभी मतलब नॉलेज होने से भी थ्योरी अलग है और प्रैक्टिकल, दोनों का नॉलेज बिल्कुल अलग अलग होती है। तो
हम्म,
इसलिए थोड़ा दिक्कत भी हो रहा है, और थोड़ा एग्जाम भी तो शायद नवंबर या दिसंबर में होगा मैम।
हाँ हाँ, दिसंबर में मोस्ट प्रोबेबली सभी
मतलब
बच्चों
रिटिन रिटिन
रिटिन रिटिन
और प्रैक्टिकल में पहले होगा।
प्रैक्टिकल नवंबर हो जाएगा,
मतलब नवंबर में
पहले प्रैक्टिकल देन वो थ्योरी।
थ्योरी। मतलब मैम पढ़ाई तो थोड़ा करना चाहिए, डिस्टेंस हो या जो भी हो, मतलब पढ़ाई तो जरूरी है। पढ़ाई के बिना तो हम ये कोर्स करके भी कुछ नहीं फायदा आएगा ना मैम। मतलब पढ़ाई जरूरी है, और फोन में बहुत दिक्कत हो रहा है। हम लोग प्रिंट आउट करने के लिए सोचे थे, मतलब 032 031 और 032 दोनों का मतलब 18 18 है, 9 9 18 18 मतलब 36। हाँ 18 18 मतलब 36 है। 36 मतलब क्वेश्चन हम लोगों को लिखना है, 36 टाइप का क्वेश्चन हम लोगों को लिखना है।
एक
तो
बच्चे
मतलब चार चार
चार
हाँ
देंगे।
चार 1 2 3 4 असाइनमेंट लिखना है। अब
और
लेकिन ये जो इतना इतना सारा हम लोग जब डाउनलोड करने के लिए जा रहा है, बहुत सारा पेज है, तो बोल रहे कि एक पेज का 10 रुपए लगेगा। मतलब बहुत ज्यादा हो रहा है ना मैम।
जरूर।
ये तो थोड़ा, मतलब हम लोग ईमेल भी किया था, मेल भी किया था, तो बोले कि हाँ हाँ स्टडी मटेरियल बहुत जल्द पहुंच जाएंगे, लेकिन अभी तक नहीं आया है। तो इसलिए थोड़ा प्रॉब्लम हो रहा है मैम। मतलब थ्योरी में क्या होगा, ये थोड़ा टेंशन में आ रही हूँ हम लोग, और
मैम
असाइनमेंट
अगर
भी
हम
जरूरी है।
लोग मैम अगर हम लोग वहाँ जाएंगे, क्या स्टडी मटेरियल्स मिल सकते हैं?
हाँ, तुम आकर भुवनेश्वर से लेकर जाओ ना। नहीं वो
ओके
तो,
मैम, ओके
हाँ वो तो वहाँ दे देंगे ना, लेकिन
ओके मैम।
थोड़ा रीजनल से पूछ कर आओ, क्योंकि इतने दूर से आओगी फिर नहीं मिलेगा तो प्रॉब्लम।
मैम फास्टिन सर, हेलो मैम।
प्रीवियस टाइम अभी नहीं, बहुत 5 6 साल बिफोर दे आर सेंट मटेरियल आवर रीजनल सेंटर से वो बच्चे लेते हैं, लेकिन अभी नहीं है।
मतलब
मैम
मैम
फास्ट
अगर अगर वहाँ पे मिल सकता है तो हम लोग कोशिश करेंगे, जाएंगे, फिर स्टडी मटेरियल लेके आएंगे, वो भी हो सकता है। लेकिन
हाँ,
मैम आप
लेकिन
थोड़ा देखिए ना हम लोगों के लिए।
ओके ओके, मैं पूछूंगी, प्रिंसिपल से पूछूंगी, बात करूंगी, तुम लोगों को बता दूंगी। ओके
मतलब नेक्स्ट डे बता दीजिए मैम, हम लोग को थोड़ा, मतलब तो अच्छा होगा। हम लोग कोशिश करेंगे जाने के लिए सभी लोग।
ओके।
तो मतलब हम लोग स्टडी मटेरियल ले आने से पढ़ाई भी थोड़ा बहुत कर सकते हैं, लेकिन फोन पे क्या है, मतलब आई का भी थोड़ा प्रॉब्लम हो सकता है। हम लोग सभी मतलब लगभग सभी चश्मा पहनते हैं, तो
हाँ
क्या है, तो अभी मोबाइल में ज्यादातर दिखने से मतलब सर दर्द हो रहा है। तो थोड़ी देर बाद मोबाइल मतलब रेडिएशन हो रहा है, मोबाइल भी तो एक रेडिएशन है ना।
हाँ हाँ, बहुत ज्यादा समय से देखने से
मतलब बहुत ज्यादा दिक्कत हो रही है मैम। तो क्या बोलूँ, यही प्रॉब्लम है। और इतना सारा प्रिंट भी नहीं कर सकते। मतलब अभी जो आपने लैपटॉप में जो हम लोगों को स्क्रीन शेयर किया था मैम, वो जब हम लोग ढूंढने लगे तो वो उसके साथ ये नहीं मैच कर रही है मैम।
हाँ
ये जो आपने पिक्चर जो पहले जो इन्फेक्शन के लिए जो पिक्चर मतलब आपने स्क्रीन में दिया था, वो बिल्कुल भी नहीं मैच कर रही थी। तो हम लोग ढूंढ ढूंढ के परेशान हो गए, सिर्फ सुनने लगे। और जो हम लोग काम कर रहे हैं उसके साथ मिल रहा है तो हम लोग वो सुन रहे हैं। ऐसा ही है। और मतलब है सभी कुछ है, लेकिन कहाँ पे है ये थोड़ा मैच ठीक से मैच नहीं हो रहा है मैम।
हम्म,
यही दिक्कत है। तो मतलब क्या बोले मैम, ऐसा ही प्रॉब्लम है।
हाँ, तो
मैम।
मिलने से बहुत ज्यादा अच्छा होगा।
हाँ मैम।
हाँ
हेलो मैम।
हाँ, यस, बोलो।
मैम फर्स्ट दिन सर told that one side assignment लिखना। तो
हाँ,
we already I already start assignment। तो
वन साइड लिखना है।
हाँ only one side।
वो भी चलेगा, कुछ प्रॉब्लम नहीं है। वन साइड लिखो, दोनों साइड लिखो, कुछ भी प्रॉब्लम नहीं होगा।
मतलब
वन साइड
मतलब मेरा
लिखने से
जो
तुम्हारा
फ्रेंड, हाँ
तुम्हारा
मेरा जो
एकदम
फ्रेंड,
ज्यादा खर्च होगा। ओके,
ओके
इसीलिए
मैम।
मेरा
मैम
पहले फ्रेंड जब
दोनों
बोला ना मैम, ये सर ने पहले दिन बोले थे कि जब हम लोगों का इंट्रोडक्शन हुआ था तभी ने सर ने बोला था कि तुम लोग जो असाइनमेंट लिखोगे तो
हाँ
A4 साइज में लिखना है। और उसको मतलब सुई के धागे से मतलब स्टेपलर नहीं करना चाहिए, सुई के धागे में उसको बांधना है। और दूसरे बात जो किया था, एक साइड में लिखना है, बोथ साइड नहीं लिखना है। तो ऐसे
हाँ,
बोला
अच्छा
था,
है,
इसीलिए
ठीक है,
फ्रेंड ने किया है।
ठीक है,
तो मतलब
प्रॉब्लम नहीं होगा। दोनों साइड लिखने भी कुछ प्रॉब्लम नहीं है, एक ही साइड लिखने भी कुछ प्रॉब्लम नहीं है।
ओके
हम
ओके
लोग
मैम, थैंक यू।
असाइनमेंट में मार्क जैसे जो जैसे कलेक्ट कर कर लिखा है, अच्छा से लिखा है, तो उसके देखकर हम लोग मार्क पुट करेंगे ना, तो कुछ प्रॉब्लम नहीं होगा। ओके, जो
मैम मैम also we want to go to submit assignment। any problem मैम?
नहीं नहीं, एनी प्रॉब्लम।
मैम
एक्चुअली
आई
मैम
हैव टाइम।
पोस्टल
हमारा
एक्चुअली मैम
जून एक डेट है ना, जून ना जुलाई डेट है
जुलाई।
सबमिट के लिए। हाँ, जुलाई हम लोग सबमिट
मैम
कर।
डेडलाइन इज सितंबर।
हाँ, सितंबर तो
सितंबर 30 सितंबर।
हाँ हाँ, तुम लोग
मैम
सबमिट करना है।
प्लीज कैन यू डिस्कस
लेकिन
वन
लेकिन जो
क्वेश्चन।
मतलब जो हम लोग डाउनलोड किए थे ना असाइनमेंट का जो लिखना है, वो 30 जुलाई दिखा रहा है मैम। और मतलब सबको एकदम से क्लियर करना है अगस्त में, मतलब ये मैम ने बोले थे पहले प्रीवियस
हाँ
क्लास में।
हाँ,
तो जो
मैम,
मतलब
हाँ,
30 जुलाई से
देने
शुरू
से
हो रहा है
अच्छा
टीचर
होगा,
की कोर्स
देने
है।
से अच्छा होगा, क्योंकि हम लोग इतना बच्चा है ना, वो सब धीरे 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 वो सब असाइनमेंट देखेंगे, फिर उसमें मार्क डालेंगे डालेंगे, यही सब काम बहुत ज्यादा काम है। इसीलिए अगस्त
मैम
तक दे देने से अच्छा है। बताओ।
मैम एक क्वेश्चन का कितना मतलब वॉल्यूम लिखना चाहिए,
हाँ,
मतलब
पेज
एक कुछ।
देखो,
हाँ
उसका
5।
क्वेश्चन क्या है। इफ डिफाइन इट, तो डिफाइन डेफिनेशन 2 मार्क का होगा। वो डेफिनेशन
मैम अगर 5 मार्क्स का एक क्वेश्चन है तो कितना पेज लिखेंगे?
क्लिनिकल फीचर लिखा है, दिस क्या क्या है, 2-3 बुक में ढूंढो। कुछ अच्छा होगा तो कुछ अधिक है तो तुम लोग और डाल दो।
मैम क्या
और
सिर्फ पॉइंट लिखेंगे या फिर थोड़ा सा ब्रीफली लिखेंगे?
तुम देख लिखना है, कुछ कुछ छोड़ छोड़ कर ये जो पॉइंट वाइज लिखना है, तो पॉइंट वाइज लिखने भी क्लिनिकल।
मतलब जो क्वेश्चन है मैम यहाँ पे जो 032 का जो पहला क्वेश्चन है, डिफाइन इंस्टेस्टाइल लंग्स डिजीज। तो ये अगर मतलब डिफाइन मतलब इसका
डिफाइन
जो
2 मार्क
डेफिनेशन
का है।
लिखना है।
हाँ, डेफिनेशन लिखना है, डिफाइन मीन्स डेफिनेशन।
हाँ, तो
और
डेफिनेशन जो लिखना है, तो ये अगर हम लोग बुक देख के लिखेंगे तो बहुत ज्यादा होगा। तो क्या करेंगे मैम ऐसा?
हाँ,
और
बुक
जो बी का जो क्लासीफाई इंटेस्टाइन लंग्स डिजीज, तो ये क्लासीफाई मतलब इसका जो क्लासीफाई करना है। तो
जो क्लासिफिकेशन है वो क्लासिफिकेशन को क्लियरली लिखना है, नहीं लिखी तो मार्क कैसे मिलेगा? लिखना है ना, कुछ
और
प्रॉब्लम
डेफिनेशन, डेफिनेशन मतलब
डेफिनेशन एक डेफिनेशन डाल दो, कुछ प्रॉब्लम नहीं है। डेफिनेशन में आ गया तो डेफिनेशन डालना है।
मतलब पूरा ही लिखना है?
हाँ, डेफिनेशन डिफाइन, डेफिनेशन कितना है, एक ही 2-3 लाइन में होगा ना
हाँ।
डेफिनेशन।
और जो
ठीक है
मतलब
मैम, थैंक यू।
डिस्कस मैनेजमेंट ऑफ पेशेंट विथ इंस्टेंट लंग्स डिजीज, उसका जो डिस्कस मैनेजमेंट का है वो तो बहुत ज्यादा है, तो वो पूरा ही लिखना है?
हाँ,
वो 8 मार्क्स का है।
8 मार्क का 4 पेज 3 पेज लिखना है, कुछ प्रॉब्लम नहीं होगा। हम लोग जितने कंसाइज कर देंगे उसमें उसमें असाइनमेंट का कुछ मतलब नहीं है। हाँ, हम लोग थोड़ा एक्सप्लेन कर कर कुछ एग्जाम्पल डालकर एग्जाम भी ऐसे लिखना है, असाइनमेंट भी लिखना है। लिखने से हम लोग जानते हैं ये बच्चे बहुत ज्यादा ठीक से लिखा है, 4-5 बुक रेफर कर कर लिखा है। हम लोग जितना कंसाइज कर देंगे उसमें क्या है, मार्क तो नहीं मिलेगा ना। ठीक से लिखना है।
अच्छा
Excuse me, ma'am.
आज का तो इन्फेक्शन कंट्रोल टोटल कोर्स हुआ, लेकिन तुम्हारा आईसीयू सीसीयू में क्या क्या है थोड़ा नेक्स्ट क्लास में थोड़ा थोड़ा मैं डिस्कशन करूंगी। अब तो टाइम भी हुआ है। ओके, एयरबोर्न आइसोलेशन, हैंड कॉन्टैक्ट आइसोलेशन, ड्रॉपलेट आइसोलेशन, ब्लॉडबोर्न पैथोजेंस, ऑक्यूपेशनल हैजर्ड्स, ब्लॉडबोर्न पैथोजेंस, ये सब तुम्हारा बुक में दिया हुआ है। बच्चों, माई सेल्फ तिलका लक्ष्मी बाई, एसोसिएट प्रोफेसर, कॉलेज ऑफ नर्सिंग बरहमपुर। ओके, मैं मेडिकल सर्जिकल का हूँ, मेरा स्पेशलिटी है मेडिकल सर्जिकल। ओके बच्चों,
ओके मैम।
ओके मैम।
ओके, क्लास एंड ऑफ करेंगे।
Thank you, ma'am.
ओके मैम, बाय मैम।
वेलकम।
थैंक यू।
सुनीता